Welcome to day 2 of HM19. What an energizing day yesterday. Inspired by Dr. Mark Harrison's compelling vision for the future and call to action. And then I don't know about you, but going to a couple of sessions yesterday, I definitely feel a lot more smart about my knowledge on hospital medicine. So hopefully you all had a chance to enjoy the sessions yesterday. And today we have another exciting day planned with our keynote speaker, Dr. Tait Shanafelt, and numerous sessions throughout the day. But first, we're going to acknowledge the stars of hospital medicine in our awards plenary session. And I'd like to start by recognizing our Chapter Excellence Awards. SHM has 65 chapters in the US and Canada and 4 international chapters. The high-performing chapters are honored here today, and they help achieve SHM's vision of providing exceptional care to hospitalized patients through extending SHM's reach to new members, providing network and education at the local level. The Chapter Excellence Awards are broken into 2 categories. The first being a tiered section where chapters can earn points by demonstrating how their chapter provides good hospital medicine citizenship, innovation, and sustainability. We have created 3 levels of achievement: silver, gold, and platinum. On the stage with me now, we have the chapter leaders who have helped take their SHM chapters to the next level. Please hold your applause until I have recognized all the chapters we are honoring today. I would like to ask our Silver Chapter Award winners to please step forward. Thank you all. I would like to ask the Gold Chapter winners to step forward. Thank you all. I'd like to ask our Platinum Chapter winners to step forward. Let's give our chapter winners a round of applause. Next, the Rising Star Chapter recognizes the chapter that's made improvements to leadership, stability, and membership. I would like to ask the Knoxville Chapter representatives to step forward. The recipient of the Rising Star Chapter Award for 2018 is the Knoxville Chapter of SHM, which has made significant strides since its launch in spring of 2017. They assembled a group of local hospitalists from Knoxville and the surrounding region to encourage participation and drive quality initiatives in area hospitals. The Knoxville chapter developed a leadership framework, including officers and board members, and just completed their first formal chapter leadership election. In 2018, the chapter held 4 meetings, including an event steered towards residents and students. Membership in the chapter has grown more than 20% since its inception. The chapter has engaged in statewide quality initiatives with the Tennessee Hospital Association and has also engaged with other chapters across the state. Congratulations to the Knoxville chapter for being named SHM's Rising Star Chapter of 2018. SHM would like to highlight a chapter which exemplifies high performance, sustainability, and innovation with SHM's Outstanding Chapter of the Year. I would like to ask the Michigan chapter to step forward, please. The Michigan chapter continues to embrace the mission of our society and nurtures a vibrant and multidisciplinary membership. It is currently the largest chapter in the program, representing more than 750 SHM members. Using a technology-enabled platform, Michigan chapter has expanded its meetings to 4 different sites, leveraging expertise from across the state. The chapter recently held its largest meeting focused on provider burnout, with more than 100 attendees across 4 different sites. It featured a main speaker as well as a multidisciplinary panel of leaders from 8 different health systems. The chapter has successfully incorporated advocacy into its annual planning and actively responds to new legislation affecting hospital medicine. It continues to be an active and valued member of the Michigan medical community and the SHM chapter community at large. Congratulations to the Michigan chapter for receiving the SHM Outstanding Chapter of the Year Award 2018. And one last time, please join me in congratulating all of our SHM Chapter Excellence Award winners. Thank you all. Before we move on to SHM's Award of Excellence, I would like to take a moment to recognize Dr. Andy Auerbach for his 7 years of service to SHM as the editor-in-chief of Journal of Hospital Medicine, a role he held from 2011 to December of 2018. I would like to ask Dr. Auerbach to join me on stage. When Andy began, JHM managed approximately 350 papers annually and was published 10 times a year. Last year, the editorial team handled more than 700 papers, content that is now published monthly in print, as well as publishing articles online only and online first. Over the past 7 years, JHM added a robust presence on Facebook and Twitter and launched a Twitter journal club using the hashtag JHMChat. Dr. Auerbach has also overseen the introduction of 2 new series, Choosing Wisely, Next Steps, and Choosing Wisely, Things We Do for No Reason, with help from the ABIM Foundation. Andy led his team to innovate and provide great service to JHM authors and the field of hospital medicine as a whole. This growth and forward-looking approach has put JHM on a strong path towards adapting to trends in hospital medicine and peer-review publishing. He has further created a strong foundation for JHM and the society. Thank you so much, Andy. Please join me in congratulating Dr. Andy Auerbach. I would like to now present our Awards of Excellence. SHM's Awards of Excellence honor the very best hospitalists in hospital medicine, those individuals who have committed themselves to truly providing the best possible care for the hospitalized patient and moving our specialty forward. Most importantly, their dedication and innovation creates a path forward for thousands of other hospitalists, guiding us and empowering us to achieve the very best in our hospitals, for our patients, and our communities. As with many accomplishments in hospital medicine, these honors are rarely earned alone. I hope that you will join me in acknowledging the contributions of their colleagues, family members, and loved ones here today. We are also taking award submissions for next year, so please visit the SHM Pavilion in the exhibit hall or hospitalmedicine.org/awards for more information. I would like to present the Outstanding Service in Hospital Medicine, which goes to Dr. Kendall Rogers, and I would like to ask Dr. Rogers to join me on stage. Dr. Kendall Rogers is a professor and chief of the Division of Hospital Medicine at University of New Mexico Health Sciences Center, a group he founded 13 years ago. His national contributions to hospital medicine include promoting protected quality time for hospitalists, developing hospitalist leaders, promoting professionalism, and partnering with information technology vendors to improve design and innovations so that health IT may achieve its full potential. He has led numerous quality innovations that has led to improvement of patient care in many areas, including glycemic control, VTE prophylaxis, transitions of care, management of alcohol withdrawal. His role as lead mentor in SHM's Glycemic Control Mentored Implementation Program contributed to SHM receiving the 2011 Eisenberg Award from the National Quality Forum and the Joint Commission. He has been a strong advocate for advanced practice providers in hospital medicine and has championed and fostered the creation of hospital medicine APP fellowship at his institution. He has been a hands-on mentor to numerous early career hospitalists, both at his own institution and nationally. Dr. Rogers is a senior fellow in hospital medicine and has served on numerous SHM committees. He is regularly sought after as speaker on topics including quality improvement, leadership, professionalism, and clinical informatics. Please join me in congratulating Dr. Kendall Rogers for his outstanding service in hospital medicine. Our next award is Excellence in Research, and this year it goes to Dr. Tara Lagu. Dr. Lagu was not able to join us here today, but I would like to take a moment to recognize her many accomplishments. Dr. Lagu is the Associate Director of the Institute of Healthcare Delivery and Population Science and an Associate Professor at the University of Massachusetts Medical School at Bay State Medical Center. She has published 103 original peer-reviewed manuscripts in high-impact journals, including NEJM, JHM, and JAMA. Her research is primarily focused on improving the quality and value of care for patients with acute illness. She has published papers examining hospital care quality for patients with sepsis, ACS, pneumonia, and delirium, and has an R01 aimed at identifying strategies used by Medicare accountable care organizations to reduce admission rates for patients with heart failure. Dr. Lagu is also very interested in improving access to care for patients with disabilities. In 2013, she conducted a secret shopper survey of physicians in a variety of practice settings across the US and found that up to 20% of physicians nationwide refused to see a patient who used a wheelchair. This work was published in Annals of Internal Medicine and was profiled in the New York Times. Dr. Lagu is a senior fellow in hospital medicine and also serves as senior deputy editor for Journal of Hospital Medicine. Please join me in congratulating Dr. Tara Lagu for her Excellence in Research Award. Our next award is our Clinical Leadership for Physicians, and this year's award goes to Dr. Harry Cho. I would like to ask Dr. Cho to join me on stage. Dr. Harry Cho is an academic hospitalist and the inaugural Chief Value Officer at NYC Health and Hospital Health Systems, the largest public health system in the US, serving more than 1.4 people annually. They say 1.4 million people annually. Wow. Congratulations. In his previous role as the Director of Quality, Safety, and Value at Mount Sinai Hospital, he founded and led the hospital's high-value care team, eventually leading more than 90 faculty, residents, and students in initiatives across health systems to improve costs and outcomes. Nationally, he has demonstrated tremendous leadership as chair of SHM's High Value Care Subcommittee and by leading the development of the next SHM Choosing Wisely list through collaboration with patient advocates and clinicians across the country. He is an active member of SHM's HQPS committee and the chapter support committee in the past, and he has been on the editorial board of the Hospitalist. Since he became a Hospitalist, he has received over 50 awards and recognitions for his work in value-based care and quality, and has spoken at over 40 lectures and workshops nationwide. He has published widely in peer-reviewed journals, including Journal of Hospital Medicine, Journal of General Internal Medicine, and JAMA Internal Medicine. Please join me in congratulating Dr. Harry Cho for his work to promote clinical leadership in hospital medicine. Our next award is the Excellence in Teaching, and it goes to Dr. Chris Moreland. If I could ask Dr. Moreland to please join me on stage. Dr. Chris Moreland is an associate professor of medicine and hospitalist at University of Texas Health, San Antonio, where he also serves as associate residency program director. He has established himself as a well-respected clinical educator, an innovator, and an administrator committed to seeing medical students and residents advance their abilities. In 2011, he collaborated with the UT Health Faculty Development Specialist to develop and direct a month-long resident as teacher elective, which has since been extremely popular. His other innovations have included a resident medical Spanish elective, a teaching track for residents, and communication-focused critical care simulation, and trilingual interpretation of OSCE for medical students. Some of his peer-reviewed publications have addressed medical schools' technical standards and the next iteration of ACGME milestones for residents. Being deaf himself, Chris continually mentors deaf residents and healthcare students across North America and advised educators working with trainees with disability. He published the first formal study of a subpopulation for physicians and students with disability, hearing loss, in 2013. He is also a fellow in hospital medicine. Chris, I want to say congratulations, and if I could ask you all to please congratulate Chris with an applause with sign language. Our next award of excellence is in clinical leadership for nurse practitioners and physician assistants, and this year it goes to Lorraine Britting. If I could ask Lorraine Britting to please join me up on stage. Lorraine Britting is the clinical director of advanced practice providers in cardiology medicine and a practicing acute care nurse practitioner at Cardiovascular Institute at Beth Israel Deaconess Medical Center in Boston. She has overseen the growth of the program from 8 to 32 advanced practice providers in the last decade. Her efforts extend across the medical center by creating and chairing multiple committees designed to address credentialing, billing, reimbursement, and recruitment issues specific to APPs. Within SHM, Lorraine has served as an invaluable member of the MPPA committee, the HQPS committee, membership committee, and as peer review for Journal of Hospital Medicine. She is a senior fellow in hospital medicine. Please join me in congratulating Lorraine Britting and her excellence in hospital medicine for nurse practitioners and physician assistants. Our Our next award is Excellence in Humanitarian Services, and it goes to Dr. Chris Olson. If I could ask Dr. Olson to join me on stage. Dr. Olson is an internist and a pediatrician and has been an academic hospitalist member of the core educator faculty in the Department of Medicine at Massachusetts General Hospital since its founding in 2005. He's also the director of the Consortium for Affordable Medical Technologies, also known as CAMTech. In 2005, he worked in Darfur before being contracted by the European Commission for Humanitarian Organizations to train birth attendants in rural Sumatra following the Asian tsunami. For the next 5 years, Dr. Olson's work resulted in creation of a network of over 350 midwives still in existence who retrain each other in newborn resuscitation and postpartum hemorrhage 3 times per year. He's an inventor and a developer of the Augmented Infant Resuscitator, a device that enables birth attendants to achieve effective ventilation in less than half the time and maintain it for 50% longer. In 2009, he was instrumental in setting up Ethiopia's first multi-drug-resistant tuberculosis treatment program, where he developed care processes and attended to patients with active TB. By 2012, more than 1,000 patients had completed therapy with unparalleled rates of success. Work through Dr. Olson's CAMTech Open Innovation Platform has empowered people the tools to solve their own medical challenges, principally in India, Uganda, and the United States. By reaching across disciplines, he's been able to align frontline health providers to work with patients, engineers, designers, policymakers, public health practitioners to make more sustainable solutions to the challenges we face in healthcare. This platform has attracted over 4,300 innovators and has led to over 100 innovations being trialed and over 30 companies formed and 40 patents filed. Please join me in congratulating Dr. Chris Olson for his excellence in humanitarian services. I have to say, I don't feel very good about myself after going through all of these awards. All right, our next award is our Excellence in Management, and this year's award goes to Stephanie Perry. If I could ask Stephanie Perry to please join me on stage. Stephanie Perry, currently the Director of Hospital Medicine Services at Virginia Mason Medical Center in Seattle, is a leader in building sustainability into the work of hospitalists. While at Virginia Mason, she developed an internal auditing and education platform to improve revenue cycle opportunities, which brought over $500,000 in additional gross revenue to the organization in 2018. Stephanie also created a structured onboarding platform for hospitalists and created a new flexible scheduling method to improve the team's work-life balance. In partnership with her leadership team, Stephanie has improved hospitalist engagement scores by 29% over the past 3 years, with 86% of physicians rating as engaged employees. This has resulted in 0 attrition since July of 2017. She is a senior fellow in hospital medicine and a true leader in her field. Please join me in congratulating Stephanie Perry. Our next award goes to Excellence in Teamwork and Quality Improvement, and it goes to the Mount Sinai Hospital High Value Care Team. If I could ask the team to please join me up on stage. The Mount Sinai Hospital's high-value care team is a multidisciplinary group focused on reducing overuse, decreasing costs throughout the institution, and allowing clinicians to focus on providing outstanding care and developing relationships with their patients. Founded by Dr. Harry Cho, who's here representing the team today along with the team, the high-value care team has chosen projects that have meaningfully impacted waste reduction in patient care. They have created a sustainable structure engaging multiple members of the care team, including staff, trainees, and students. Its collaborative environment in and on itself demonstrates high value, and it has helped improve staff satisfaction and retention. The team has focused on areas identified as wasteful by SHM as part of ABIM's Choosing Wisely initiative. Projects have decreased lab testing, including amylase, folate, and routine lab tests, as well as medications such as docosate. Additionally, the team has tackled telemetry and urinary catheters and has improved patient mobility and inpatient sleep. Their innovative work can help speak to similar programs nationally. As a result, the team has created reduced wasteful practices, decreased costs, and allowed clinicians to focus on providing outstanding care and developing relationships with their patients. In addition to many hospitalists, the high-value care team consists of members from Mount Sinai's nursing, pharmacy, laboratory, and IT departments, including Dr. Andrew Dunn, Dr. Beth Rocher, Dr. John McClaskey, Nicole Wells, Suzanne Kushney, Surafel Siga, and Gina Caliendo. Please join me in congratulating the Mount Sinai Hospital high-value care team for its excellence in quality improvement as a team. Thank you all. Congratulations. Our next award is for our Junior Investigator Award for Dr. On Nguyen. While Dr. Nguyen could not join us today, I would like to take a moment to review her many accomplishments. Dr. Nguyen is an assistant professor in the Division of Hospital Medicine at University of California, San Francisco. Her research is focused on understanding and optimizing hospital care in safety net settings and pragmatic approaches to addressing the social determinants of health and transitional care strategies that address coexisting social vulnerabilities. Her current work, funded through a K-23 award, seeks to develop a strategy to predict, understand, and address coexisting social vulnerabilities among adults hospitalized with congestive heart failure and ischemic heart disease who are at high risk for readmission. While she's early in her investigative career, she already has 32 peer-reviewed publications with another 4 first-author manuscripts under review in preparation. She is an associate editor for Journal of Hospital Medicine. We'd like to congratulate her for her many accomplishments. I would like to take a moment and recognize our 2018 Student Hospitalist Scholar Grant recipients. SHM is proud to acknowledge the latest winners of the Scholar Grant Program. These medical students were awarded scholarship grants to complete scholarly work with an active SHM mentor in a project related to patient safety, quality improvement, or other areas relevant to the field of hospital medicine. I would like to ask you to join me in congratulating our grant recipients. I would also like to congratulate the latest winners of our SHM Resident Travel Grant winners. To qualify for this award, these residents submitted an abstract for consideration in the RIV session at HM19 as first authors. Each of them produced outstanding work worthy of recognition. and I'd like to ask you to join me to congratulate these outstanding residents. I would now like to invite to the stage the incoming president of Society of Hospital Medicine, Chris Frost, who will introduce our keynote speaker for today.